Hello and thank you for joining me today. My name is Zainab and I'm pleased to present my research as part of the COVID Information Commons Student Paper Challenge. Today I'll be discussing how cyber attacks targeting healthcare during the COVID-19 pandemic exposed critical gaps in international legal protections and why this matters for patient safety, global health governance, and humanitarian law. This presentation is based on my research paper titled Cyberattacks on Healthcare During COVID-19 Gaps in International Humanitarian Law, and it examines the intersections of cybersecurity, healthcare, and international law during one of the most disruptive global crises in recent history. I'll begin by explaining why this issue matters before moving into the legal framework, data analysis, and key findings. The COVID-19 pandemic placed unprecedented strain on healthcare systems around the world, pushing hospitals and health organizations to their operational limits. At the same time, healthcare rapidly shifted to our digital systems, from electronic medical records to telemedicine and centralized data sharing. This digital dependence created a critical vulnerability. Cyber attacks during a public health emergency are not merely technical disruptions. They directly threaten patient safety and also access to care. During the pandemic, healthcare organizations experienced a sharp rise in ransomware attacks and phishing campaigns, and hospitals and public health agencies were widely labeled as soft targets due to outdated security systems, limited resources, and the urgency of patient care. Importantly, cybercriminal activity shifted away from individual victims and toward critical health infrastructure, where disruption could have large-scale consequences. This research focuses on cyber attacks targeting healthcare systems during the COVID-19 pandemic, a period marked by heightened vulnerability and global crisis. The analysis is conducted through the framework of International Humanitarian Law, or IHL, which traditionally governs conduct during armed conflicts. The core research question guiding this study is: do existing legal protections remain effective when healthcare systems are disrupted by code rather than physical weapons? International humanitarian law is a body of international law created to limit human suffering during armed conflicts. Its primary purpose is to protect individuals and institutions that are not participating in hostilities, including civilians, patients, medical personnel, and humanitarian organizations. Within this legal framework, hospitals, ambulances, and healthcare services receive a special protection because of their essential life-saving role. These protections were historically designed to prevent physical attacks, such as bombings or military assault on medical facilities. Cyber operations differ fundamentally from kinetic weapons. Harm is inflicted through code rather than physical force, making damage less visible but no less consequential. Attribution is also especially difficult in cyberspace, where attacks may be carried out by non-state actors or disguised as state actors. Crucially, cyber attacks can cause serious patient harm without physical destructions, such as treatment delays, system outages, or data manipulation. Existing enforcement mechanisms under international humanitarian law struggle to address accountability and deterrence in these digital environments. To examine these issues, this study employs a mixed methods approach. The analysis integrates quantitative data analysis, international legal analysis, and comparative case studies to capture both technical trends and legal implications. Cyber incidents are examined across pre-pandemic, pandemic, and post-pandemic periods in order to identify shifts in targeting patterns and long-term vulnerabilities. The quantitative data in this study comes primarily from the Interpol COVID-19 cybercrime report, which provided detailed statistics on spam, malware, and malicious URLs targeting the health sector. Additional data was drawn from World Health Organization cyber incident reports spanning 2020 through 2024. Case documentation included the Dusseldorf University Hospital ransomware attack, the WHO credential breach, and the Change Healthcare attack in the United States. All quantitative analysis was conducted using Python to ensure transparency and reproducibility. The workflow involved filtering healthcare-related cyber incidents, aggregating trends over time, and generating comparative visualizations. The goal was to translate complex cybercrime data into clear visual trends, showing how attacks evolved before, during, and after COVID-19. Between January and April of 2020, global cybercrime activity surged dramatically as the pandemic unfolded. Interpol reported approximately 907,000 spam messages, 737 malware incidents, and 48,000 malicious COVID-19 related URLs during this early period. These attacks increasingly targeted healthcare institutions and public health organizations, reflecting a strategic shift toward critical medical infrastructure during this crisis. In the next section, I'll examine how these trends evolved beyond the initial surge and what they reveal about the long-term targeting of healthcare systems. In April 2020, the World Health Organization reported a five-fold increase in cyberattacks targeting its digital infrastructure. As you can see here, while core operational systems were not destroyed, approximately 450 staff email credentials were leaked, exposing internal communications during a global emergency. What's important is that even without direct system failure, attacks at this level undermine trust, coordination, and secure information sharing, which are essential for global health governance during a crisis. I now want to shift to direct patient-level consequences. In September 2020, a ransomware attack disrupted operations at University Hospital Düsseldorf for more than a week. As critical systems became inaccessible, patients had to reassign, and urgent treatment was delayed. This incident was later investigated as a possible case of negligent homicide, marking one of the first times a cyber attack was publicly linked to a potential patient death. This case shows that digital attacks can produce real-world physical consequences, even without visible destruction. As you can see in this chart, comparing incidents across healthcare systems reveals a spectrum of cyber harm. Attacks on organizations like the WHO primarily threaten reputation, trust, and coordination at a global scale. In contrast, attacks on hospitals escalate quickly into life and death situations, directly disrupting patient care and treatment delivery. This comparison helps illustrate why cyber attacks in healthcare cannot be treated as uniform or purely technical events. Bringing these findings together, several key patterns emerge. Cyber attacks against healthcare surged during the COVID-19 pandemic, driven by increased digital dependence and crisis-related vulnerabilities. Phishing and ransomware became dominant attack methods exploiting urgency and system overload. Most importantly, even after the peak of the pandemic, healthcare remains one of the most consistently targeted sectors, indicating persistent structural weaknesses. This brings us to a critical point. Cybersecurity in healthcare is not a technical afterthought. It is a core component of patient safety and public health protection. Repeated cyber attacks erode public trust in digital health systems and weaken confidence in institutions responsible for care and coordination. The World Health Organization has described ransomware attacks on hospitals as a matter of life and death, underscoring the severity of these threats. Like any research, this study has important limitations. Cyber incidents targeting healthcare are often underreported, particularly in regions with limited transparency or reporting capacity. Establishing direct causality between cyber attacks and patient outcomes remains challenging, as seen in cases like Düsseldorf. Additionally, this analysis focuses on well-documented incidents, meaning smaller or less visible attacks may not be fully represented. In conclusion, the COVID-19 pandemic exposed how vulnerable healthcare systems are to cyber operations. It revealed critical gaps between existing legal protections and the realities of digital conflicts. To safeguard healthcare effectively, the international community must adopt more enforceable legal norms and invest in cybersecurity resilience as a core public health priority. Future research should expand datasets and machine learning and apply machine learning-based detection methods and promote global collaboration among institutions such as WHO, Interpol, and humanitarian organizations. The key sources informing this research are listed here, including reports from Interpol, the World Health Organization, the ICRC, and peer-reviewed academic literature. Thank you for taking the time to engage with this research. I would like to sincerely thank the COVID Information Commons, the Student Paper Challenge team, and everyone involved in supporting this program. Initiatives like these create vital spaces for students to contribute meaningfully to global conversations at the intersection of health, technology, and policy. This challenge not only supported my research, but it reinforced the importance of interdisciplinary approaches to addressing complex global problems. Thank you again for your time and consideration.